acetabulum, right? Acetabulum. That's the cup that is going to be the acetabulum. That's okay. Let me jump over one thing. Oh no, I take it back. I'm not going to jump over one thing. So the head. I want you to notice, guys, in the head, there's a little bit of an indentation. This is called the fovea capitis. That little indentation in the head is the fovea capitis. This holds a ligament that's inside the hip joint, so that's why that's there. So the head, the fovea capitis. What's the constricted area below the head always? The neck. So this area right here, this whole thing is the femoral neck.
So if we just say neck, that's fine?
Yeah, that would be okay. I would prefer you said femoral neck because other bones have necks too, but that's okay. I'm assuming you know it's the femur. Now, when somebody breaks their hip, like sometimes you hear about like an elderly woman falling and they fracture their hip, this is what usually fractures. Again, I won't ask you this, but just so you know, this is when a fractured hip occurs, and then they got to go in and they got to pin it like it's a surgical procedure. So that's where the neck would be. Now, this big chunk of bone right here on the outside, if you went to the wide part of your hip, like right out here on the femur, this is the greater trochanter. Okay? Look at the size of this chunk of bone right here. This is the greater trochanter right here. We have a lot of big muscles, the glute muscles, some of the pelvic muscles below the glute that I'm going to teach you. They all attach to your femur here. So that's the greater trochanter. And then this little guy right over here is also a trochanter. What do you think we're going to call that one?
Lesser.
Lesser. Okay, the lesser. All right? Do me a favor, cross out, if I have on there, because a lot of our models don't have it, intertrochanteric line. Not the crest. Cross out the line. Intertrochanteric line. You can strike that, please. Cross out gluteal tuberosity. Always fun to cross out one or two things, right? Cross out adductor tubercle. Right, so three things, right? Intertrochanteric line, gluteal tuberosity, adductor tubercle. Strike those.
What is the last one?
The second one is C.
Everybody have it? We're good? So watch this. Greater trochanter, lesser trochanter. So watch this. On the back of the femur, there is a ridge of bone. Mine's not that great. You probably have some better ones there. There's a ridge of bone connecting the two trochanters. This is called the intertrochanteric crest. What does inter mean again? Between. Trochanteric means the trochanter. So it's connecting between the trochanters. Okay? In the back, it's a big ridge, then we call it a crest. Our models don't show it, and I had to strike this one out. In the front, there's a thin line that connects the two. That's where the intertrochanteric line would be. Again, most of our models don't have it. I think maybe one bone in this room has it. I think you guys in the back happen to have the one that has it. So I'm just going to strike it out because most models don't have it. But if you think about it, the muscles in the back of your pelvis here are bigger. They need a bigger bone to attach to than a thin line on the front. The muscles in the front aren't quite as massive, so they don't need as much of an attachment point. So the intertrochanteric crest is the one that I want you to know. Gluteal tuberosity, we're going to strike. What's this whole part going to be called here? Shaft. Now watch this, guys. On the back of the shaft, posterior, you're going to feel a big ridge of bone coming down here. This helps to tell you that's the back. This is the linea aspera. Linea aspera. We're going to see a lot of muscles attaching to this line right here. Okay, linea aspera. Here it is on my picture. This big ridge of bone right here. Linea aspera. Some people say aspera. However you want to pronounce it, it's fine. Okay, so the two trochanters, the intertrochanteric crest, linea aspera. Let's go down to the distal end. So these two rounded portions right here are the femoral condyles. Femoral condyles. Remember I said earlier a condyle is always in a joint. Always in a joint. So watch this. The bone below the femur is the tibia. The femoral condyles are going to articulate with the tibial condyles like this. Okay, that the bone doesn't touch the bone. He'll tell you there's two pieces of cushion in there called the meniscus. And they're pieces of cartilage that kind of are between the femoral condyles and the tibial condyles. So again, if you remember, condyles are always within a joint. You'll know where to find them, right? The condyle of the humerus, the femoral condyle, the tibial condyle. All right, so these are your two femoral condyles. Outside of the condyles are two chunks of bone, right above, right here. These are the epicondyles, right? Epi means above or upon. So condyles here, epicondyles there. I know two of them we took out. Last two things. This space here, guys, between your two condyles of the femur is called the intercondylar fossa. Inter, again, means between the condyles, and it's a fossa. Have you ever heard of ligaments called like the ACL? People have like ACL tears, anterior cruciate ligaments. The PCL, those are ligaments that actually travel in this space right here. So that's where they're running. They're ligaments within the knee. So when they do surgery on your ACL or your PCL, they're going into this spot right here, okay? Condyles, intercondylar fossa. One other bone I need you to take out, sorry. Take out the little triangular bone. Anybody know what this is?
Patella.
The patella, good, the kneecap, right? So watch this. On the front of the femur, right about here, there's a smooth surface where our patella is going to sit like this. So we call that surface the patella surface. Patella surface, okay? Nice easy bone. Anybody, questions or comments? So guys, watch this. On the patella, it's a triangle. So again, what's the flat part of the triangle called?
Base.
The base. So the base is the flat part. That is going to sit superiorly. What's the point of a triangle? The apex. That is also going to face down, just like the apexes we've seen today, the last couple of weeks. The sacral apex face down. The coccygeal apex face down. The apex of the scapula face down. Same thing here. The base is up. The apex is down. Now, on the back of the patella, there are two flat surfaces. If you remember from last week, a flat surface is a facet. Remember we were palpating the facets on the vertebrae? So these are your two facets. You can strike medial and lateral. Just know the back has the facets. I will not ask you which is the lateral facet. I will not ask you which is the medial. Just know that they're both facets. You do not have to differentiate medial or lateral. I mean, if you want to learn them, you can. I'm not going to ask you. All right, just know that these are the facets. That's it. Okay? Yep, they're on the back. You just don't have, I think I put down, didn't I say, the lateral one was the bigger one and the medial one is the smaller one. I don't care about that. Don't worry about that. If I were to point to it, just say facet. That's that. Okay, facet. That's the patella, that easy. Okay? Now,